Hello everyone. So today we'll be talking about one of the very fascinating and very interesting and one of the very important topic of about portal venous system. It is related not only to the basic sciences it is not only important for anatomy, but it helps to explain lot of clinical condition, and it is necessary in the pediatric surgery medicine every each and every subject. This is very useful if we know about the basics of anatomy of the portal venous system. So let's start. So what is portal venous system? It is the system of vein that carries that helps to that is that directs blood from various parts of gastrointestinal system to the liver. The main part of portal venous system is the portal vein. It is found by the, as we can see in the chart, it is found by the two combination of the splenic vein and the superior mesenteric vein. And the portal vein is a large vein which collects blood from the various part, the alimentary, various abdominal part of alimentary tract, the gallbladder, the pancreas, the spleen, and the and it and in liver. The portal vein breaks down into the sinusoid, which are drained by the hepatic vein, and finally the hepatic vein drain into the inferior vena cava. And this system is called portal vein because, and this is vein is called portal vein because its main tributary, the superior mesenteric vein, begins in one set of capillary in the gut, and the portal veins in the another set of capillaries in the liver. As and we have said, the portal vein is found by the union of superior mesenteric and splenic vein behind the neck of the pancreas, and at the level of second lumbar vertebra, and the inferior mesenteric vein drains into the splenic vein. And the length of the portal vein is around 8 centimeter, and it runs upward. It runs upward and a little to the right, first behind the neck of the pancreas, and next behind the first part of duodenum. First of all, it lies behind the neck of the pancreas, then behind the neck of the duodenum, and then lastly in the right free margin of the lesser omentum. It lies, and the blood flow in the portal vein is very slow. The blood from the superior mesenteric vein drain into the right lobe of the liver, and the blood from the inferior splenic and the inferior mesenteric vein drain into the left lobe, and this is also known as streamline flow. And the portal vein can thus be divided into one, we can infraduodenal, retroduodenal, and supraduodenal part. And the portal vein terminates by dividing into right end of the porta hepatis by dividing into right and left branches which enter the liver. The portal vein has branches known as right and left branches. The right branch is shorter and wider than the left branch, and after receiving the cystic vein, it enters the right lobe of liver. And the left branch is longer and narrower than the right branch. It traverses the porta hepatis from the right end to the left end, and furnishes branches to the caudate and quadrate lobes. And just before entering the left lobe of liver, it receives para-umbilical vein and ductus venous during the fetal life. Now talking about tributaries of the portal vein, first of all, the tributaries, there are various tributaries of portal vein. One is we have the left gastric vein. The one is, we can see here in that very clearly, one is left gastric vein, right gastric vein, the superior pancreatico duodenal vein. Here you can see the superior pancreatico duodenal vein, the cystic vein in the right branch, and the para-umbilical vein in the left branch. And these are the branches of the portal vein. And the left gastric vein accompanies the corresponding artery, and at the cardiac end of stomach it receives few esophageal vein. And the right gastric vein accompanies the corresponding artery, and it receives the prepyloric vein. And the preumbilical and the para-umbilical vein are small vein that run in the falciparum ligament along the ligamentum teres and establish anastomosis between veins of the anterior abdominal wall present around the umbilicus and portal vein.